Now, from CBS 4 News, this is Facing South Florida with Jim DeFede.
I'm Lauren Pastrana. Welcome to Facing South Florida. Jim DeFede is off this week. More than 33 million Americans have gotten at least one dose of the COVID-19 vaccine. But a new poll shows 1 in 3 Americans say they will likely not be vaccinated, most citing safety and effectiveness concerns. But for some, the skepticism of vaccines runs much deeper. February is Black History Month, and part of that history includes instances of scientific misconduct that's led to African-American distrust in the medical community. And in a raging pandemic in which disparities by race have been amplified, that distrust could have deadly consequences.
Going home.
60-year-old Felicia King has underlying health conditions, but she says when it's her turn, she has no plans of getting the COVID vaccine.
The White House has been so chaotic in the last term. Who's to believe anything that they say?
She's not alone. Data shows African Americans are the least likely to get the vaccine.
I don't trust it. And going back to history, way back, look what they did to the men in Tuskegee.
The 1932 Tuskegee study, where for 40 years the federal government withheld treatment to hundreds of black men who had syphilis to study its long-term effects. It caused suffering and, in some cases, death.
How do you feel about being used as a guinea pig?
Well, I thought once it was pretty rough.
And in the 1950s, a Baltimore doctor biopsied the cancer cells of Henrietta Lacks. Without consent, researchers continued to use the cells for decades without compensating her family.
I think all of that needs to be acknowledged and actually can't be trivialized, because I think our communities have had to deal with the medical profession with some amount of skepticism that was protective. But then I would also say that this isn't the moment that we're in now.
Experts say the development of the various COVID vaccines is different in many ways. Trials were conducted on thousands of willing volunteers from diverse backgrounds. Dr. Kizzmekia Corbett, a black woman, is the lead scientist who helped develop the Moderna vaccine.
The vaccine teaches the body how to fend off a virus because it teaches the body how to look for the virus.
And medical professionals were first in line for the shots.
So we have someone from our own community who's developing these vaccines for our community, which needs it the most.
Lily Tyson Head wants to get the vaccine. Her father was a participant in the Tuskegee study.
They wanted the men to die so that they could figure out how the syphilis affected their bodies.
She said a key point in the government's deception, withholding the cure to syphilis so they could study how the deadly disease spread in black bodies, is the very reason why she is determined to roll up her sleeve for the COVID vaccine.
When the vaccine is available to my group, I plan to take it. My father was denied that opportunity.
The lie behind the Tuskegee experiments was brought to light in 1972 by Associated Press reporter Jean Heller. Her investigation revealed that doctors learned penicillin cured syphilis a few years into the study, but they withheld the treatment from the men for nearly 40 years.
The African-American community has had experience with vaccines has not been good. Right? This is a new day.
In Miami, Commissioner Jeffrey Watson says it's important to spread awareness as well as accurate information about the vaccine.
Some people want to talk to their doctor. They should, in a hurry. Some people want to talk to their religious counselor. They should, in a hurry. We have the vaccine. Your audience should know that we do. And we're going to do the best we can to get to those people who would like to be vaccinated.
The vaccine is good and it saves lives.
If you're concerned about the vaccine, it's important to talk to someone you trust, like your own healthcare provider. For many, the idea of driving to a stadium or even a hospital to have a stranger vaccinate them can be intimidating, but perhaps they'd be more comfortable with their own doctor. I spoke with Wayne Bracken, the Chief Executive Officer of Kids Medical Services, and Dr. Tina Carroll-Scott, the Medical Director of the South Miami Children's Clinic, on how to build trust in the vaccine in our community.
Dr. Scott and Mr. Bracken, thank you so much for being with us today. Before we get into why certain communities might be skeptical of getting the COVID-19 vaccine, first, let's take a step back and let's look at the rollout of the vaccine here in South Florida, the state of Florida, and really the United States. Mr. Bracken, I'm going to start with you here with this question. What do you think has been the successes and the failures sort of the way this has all been rolled out? You and Dr. Scott penned an op-ed in the Miami Herald saying that there could be a better way of doing this right here very locally. Tell us about that.
Dr. Scott and myself, as we discussed this issue about why is there such a relatively low uptake of people looking to get vaccinated, a lot of it has to do with simple access. And the way this started out with the focus being on the hospitals was good, but limited. And as we started to see at the beginning of this month, for example, we were probably nationally at maybe 1.5% of the population being vaccinated. And so this reliance on our community hospitals, which are great. I mean, Jackson has done an incredible job, Baptist Health, the HCA hospitals, Mount Sinai, the Broward hospitals, they've all done incredible work. Getting the healthcare workers vaccinated, most important, and then starting to help into the community. But to really reach out deeply into our society, we need to actually reach out and not just wait for people to come to the door.
And Dr. Scott, that's where doctors like you come into the picture. That's where that trust is really built in your offices, where you have that one-on-one, face-to-face time with your patients. So let's talk about that trust and how important it is for people to be willing to roll up their sleeves and allow someone to put a brand new vaccine into their arms. What sorts of mistrust and are we seeing right now as far as the COVID-19 vaccine goes?
So I'm going to talk specifically about the community where I work, which is primarily African American with a smaller percentage of Hispanic patients. But there is a tremendous amount of mistrust or distrust, especially in the African American community, that is being disproportionately affected by this virus, with not only hospitalizations, but with death rates. And I think in order to really understand what's going on with that distrust, we have to understand the history. And probably the most infamous study that occurred was the Tuskegee syphilis study, which took place in 1932. And in this study, there were a group of Black men who were enrolled to look at the effects of untreated syphilis. Consent was obtained, but not informed consent. And the men were told that they were being treated for, quote, bad blood. And procedures such as spinal taps were performed on them without anesthesia. And even when penicillin became a safe and effective treatment for syphilis in 1947, many of the men didn't receive treatment. And the study was supposed to only take place for 6 months, but went on for 40 years, ending in 1972. So now couple that history with the racial unrest that we're experiencing today and the current racial health disparities that exist. And it's not surprising that you see Black communities having this amount of distrust surrounding the COVID vaccines. So part of my job and that of many of my Black colleagues working in similar types of communities is to regain that trust, acknowledging the history, but also assuring people that something like this could never happen again, that we have many safeguards in place, and that they don't have to be afraid of that. I think we also have to recognize the other reality, which is that there's a raging pandemic hospitalizing and killing Black and brown people disproportionately. And so I think the education is going to be key. And it's going to take trusted messengers like myself and other community leaders delivering that message to these communities. I tell my patients all the time that they have to respect and value their health, and especially when it comes to this virus. And that starts with getting properly informed and demanding that their communities be prioritized in these vaccine rollouts. Because what I don't want to see is for these communities to get victimized twice. First with the medical experimentation, and then second by exclusion by not getting this valuable vaccine.
I think there's better and better communication. But that communication only reaches so far. And I think that's why Dr. Scott is such a good example of why we need to rely on community physicians to be a much bigger part of this solution. In the 10 years since her clinic was created, she became a trusted role model, particularly in the South Miami community. So you have children, their parents, their grandparents, and their extended families have a long track record with her, where she's saved their lives, she's changed their lives, it's built up a trust level that allows for her word and her approval and her recommendation to take the vaccine. Her words carry a lot of weight. And if you multiply her by tens of thousands of physicians across the state of Florida, then you really can start to have an impact.
Dr. Scott, Mr. Bracken says your words carry a lot of weight. So what are the words you use when patients or their parents perhaps go into your office and say, what do you think? Should I get the vaccine? Should I get the vaccine for my parents? Should I eventually be looking at this for my children? What do you tell them?
So that is sort of, the type of physician I am anyways, outside of the COVID vaccine, is that I walk the walk. And I never recommend anything to any patient that I would not do for myself or recommend for my kids or my family members. So I knew for me that this was going to be really important to get the type of buy-in that was needed for my patients surrounding this vaccine with the history that we're talking about. So at the first opportunity, I made sure to get myself vaccinated. And I am not much of a social media person, but I thought it was important for me to post pictures of me getting vaccinated, and also to educate patients around the vaccine, how the vaccines work, the safety profile, all of the questions that I think have been preventing people from wanting to take this in the first place. I think representation absolutely matters, especially in communities of color. When people see people who look like them, that maybe have a similar history, I think it's just one less hurdle that you have to overcome.
Let me add one more thing that I think is very pertinent to the discussion. Every year, the Gallup polls across America and ask, who are the most trusted members of our society? What are the most trusted professions? And every year, the winners are doctors and nurses, number 1 and 2. They change places once in a while, but they're always number 1 and 2. We need to leverage that trust and take advantage of doctors like Dr. Scott and the thousands of doctors, as I said earlier, across the state. They want to do the right thing. They want to help, and they are uniquely positioned to do that.
Dr. Scott, Mr. Bracken, thank you so much for joining me today.